everybody. I know that I'm competing with lunch, and thank you very much for spending the next 15 minutes here with an interesting topic called innovation through collaboration. So why is Bayer actually here? Bayer is definitely not a startup. We are existing for a bit more than 150 years. So we are, of course, not a startup. But we have an overarching common interest because the key topic here in this event is innovation. And this is what Bayer actually is all about. Bayer is all about innovation. So what do? As you are probably aware, one of our key business areas is health and healthcare. And we are facing massive changes in this area. As you're all aware, one is the growing population. So today we have 7 billion people on Earth. In the future it will be, so 2050, not so far away, it will be approximately 10 billion people on Earth. And we have an ever-increasing life expectancy. When Bayer was founded 150 years ago, average life expectancy was around 40 years. Today it is around 80 years. That's a very positive news. On the other hand side, it of course brings massive changes to the healthcare systems, especially also to the payers in the system. Second business area is plant health, actually, so crop protection, crop science, and also there the trend of the growing population actually results in massive challenges. So we have the growing population, we have limited available agrarable land, plus we have climate changes and challenges, and that actually means that the productivity will need to increase by 60% over the next years in order to feed the population in the world. And then, last but not least, we are active in the animal health area. That is basically two different areas. One is the companion animal area, so cats and dogs and all these animals you have at home, and on the other hand side it's the professional farm animals, which are of course also crucial for food production, especially when you think about meat production. And there's especially meat production in the developing countries increasing all the times, so this is also a huge challenge. So basically Bayer is clearly a life science player, not a chemical player. We are basically the only company which is dealing with human beings, with plants and with animals. Coming to Bayer in the Nordics, we have a significant presence here in the Nordics. So all in all, we are talking about 1,300 employees in the Nordics, with of course different places where Bayer is around. But the most significant presence, so almost 50%, are basically based here in Finland. So you're probably aware that Bayer has a research and production facility in Turku. Plus, we are one of the only, if not the only, healthcare companies, international healthcare companies who have their headquarters here in Finland. So our Nordic headquarters is located here in Espoo, where we have, of course, administrative functions plus marketing and sales functions, but we are also having the fourth biggest clinical development organization here in Finland. So from the Bayer perspective, it's the fourth biggest clinical organization. Number 1 is Germany, number 2 is US, number 3 is China, and then comes Finland, which is kind of surprising, but it has a good reason, because Finland has a very good research and development infrastructure plus capabilities. So that is the reason why we have such a big organization sitting here in Finland. So, looking at the global trends, and this is not only true, of course, for the Nordics, but looking at the global trends, but has been developed in the steering group together with Finland Health, where Bayer also had an active part. In healthcare, I mean, you're all aware of that. We have a growing burden of chronic diseases, with that also a massively resulting challenge from the cost perspective. We have a shift towards preventive healthcare. We have a focus on health outcomes, increasingly engaged customers, demand for connected and mobile care, plus a need for targeted therapies. So put your name on this pill. These are the key trends which have been identified in that steering group. But looking at the resulting needs, there is a clear need for innovative healthcare solutions, validated, and that's important, validated by real-world outcomes. There is a need for fast adoption of predictive analytics and novel therapy targets, and definitely a strong public and private collaboration environment which is definitely needed in order to tackle all of these trends. So looking at it, tackling these trends, one area is of course technology, and there's a radical move in this technology area when it comes to speed. Just a few examples how technology has evolved. I mean, looking at some key technologies, protein characterization, DNA sequencing, gene therapy. In the 90s, for example, if you wanted to sequence a DNA, it would take you 15 years and costs a massive amount of bucks. Today, you can do that in 2 hours with money less than $2,000 actually. So there's a massive development when it comes to speed in technology, and these are some enabling technologies which are actually key to address the unmet medical needs in the health sector. But there's more than technology. We in Bayer truly believe that the best ideas will not come out of our Bayer-owned facilities only. So there's a clear need for collaboration. And this has also been defined in the Team Finland Health steering group. There's a clear need for collaboration between academia, government and industry in order to serve the society with better health provisions, to foster new research potential, to increase investments, and with that lead to economic growth. As you know, Finland has put the health strategy as a key pillar for future economic growth on its agenda, and we truly believe that there are very good capabilities, but it's all about collaboration, and that will lead to further innovation. Bayer has been massively active when it comes to innovation in the Nordics, and specifically also here in Finland. You see some examples here. So we had the first decision in 2011 to put our headquarters here to Espoo with assets of above 3 billion euros. Then of course we have product innovations, and we have 3 product innovations, or at least 3 product innovations coming out of the Nordics. One is definitely Mirena and the whole contraception, long-term contraception family, which is JDS, and as well Kailina, which is produced only in Turku. But then we have also acquired Algeta with a, let's say, unique radiopharmaceutical therapy in the oncology area, sitting in Oslo. Algeta I already mentioned. Then we have significant co-development agreement with Orion Pharma, also in the cancer area. Plus we have startup collaborations, just a few examples, with Delsitech, research collaboration in ophthalmology, for example. Plus we have been a major corporate partner in the Slush event. This was also a massive activity in the last year. Then when it comes to institutions and academia, worthwhile to mention here is Bayer has actually been the first pharmaceutical company going into a collaboration agreement with Auria Biobank here in Finland. So the biobanks are definitely a very interesting area, and also in terms of corporate social responsibility. Just also one example is the Jardel Access program, which is actually coming out of the Nordics, meant to provide contraception to women in developing countries. So quite a massive activity in this area. When it comes to the Nordics and how the Nordics can really make the Nordics a markable spot on the world map of innovation, it's clearly joining forces and bringing together all the different and fantastic assets we have in the Nordics. Just as an example, in Finland, for example, the biobanks, and there are many more. Then we have in Oslo the Cancer Center, we have Sweden with the Karolinska Institute, and we have Medicon Valley. So clearly join forces and make the Nordics, and kind of linking it to the speaker which was here before me, also the Baltics can play a massive role in that. So joining forces, adding critical mass will definitely improve the growth opportunities for the Nordic cluster in health. As a summary, for Finland specific, I mentioned it, we have a good infrastructure, we have very good capabilities, we have very good assets here in Finland when it comes to research. What we think, and also Team Finland Health identified, was definitely further kind of foster the incentives behind research and development activities, in Finland. Nordic collaboration, just mentioned, a very crucial point. Finland alone or all the Nordics together, that would definitely have a much more powerful impact. The regulatory framework definitely could be improved in order to make Finland more attractive for international companies to bring in foreign direct investment. And last but not least, also the innovation appreciation here in Finland. So how do we appreciate innovative pharmaceuticals coming to Finland? Definitely also plays a massive role in making Finland a more attractive place for external or foreign investment. So that was it, mainly. I know here are also many startups. Just one thing as a closing remark, if you have something where you think a collaboration would make sense with a company like Bayer, here are some just examples for platforms where you can basically connect with Bayer. And you can, of course, also connect directly with people from Bayer, which you meet here, which you meet in your countries. So highly welcome. We are absolutely convinced on also collaboration and external opportunities and co-creating of innovation. So thank you very much.